Halo semuanya, saya Miranda Mahsa. Saya mahasiswa UAS Kedokteran Gigi di salah satu rumah sakit gigi dan mulut. Saya akan mengajak kalian untuk memperkenalkan ronsen di rumah sakit gigi dan mulut. Terima kasih telah menonton video ini karena kami akan mempertahankan senyum lebarmu. Pertama-tama saya akan menjelaskan ronsen. Ronsen atau X-ray adalah prosedur pencitraan medis yang menggunakan radiasi elektromagnetik untuk menghasilkan gambar struktur dalam tubuh seperti tulang, organ, dan jaringan lunak. Kenapa sih kita harus ronsen gigi dan mulut? Yang pertama, mendeteksi kerusakan gigi yang tersembunyi. Kedua, melihat struktur tulang dan akar gigi. Ketiga, merencanakan perawatan ortodonti. Keempat, mendeteksi infeksi atau penyakit gusi. Kelima, mengevaluasi gigi bungsu. Dan keenam, menemukan kista atau tumor di rahang. Ronsen di RSGM ini ada panoramik, cephalometry, dan periapikal. Perbedaannya apa sih?
Gambaran macam-macam ronsen pada gigi. Panoramik, foto keseluruhan rahang atas dan bawah dalam satu gambar. Cephalometry, foto yang menampilkan struktur tulang wajah dan posisi gigi dari samping. Periapikal, foto yang fokus ke satu atau beberapa gigi, termasuk akar dan jaringan sekitarnya. Kegunaan ronsen pada gigi. Panoramik, gambaran keseluruhan gigi dan rahang dalam satu foto, digunakan untuk mendeteksi gigi bungsu, kista tumor, dan perencanaan ortodonti. Cephalometry, foto tengkorak dari samping untuk melihat hubungan rahang gigi dan wajah, berguna dalam perawatan behel dan analisis pertumbuhan rahang. Periapikal, gambar detail satu atau beberapa gigi beserta akarnya, digunakan untuk mendeteksi infeksi akar, penyakit gusi, dan persiapan Nah, saya akan mengajak kalian untuk gimana sih cara ronsen di rumah sakit gigi dan mulut. Sebelumnya, disarankan untuk konsultasi terlebih dahulu ke dokter gigi untuk mengetahui ronsen yang kamu perlukan lebih tepat. Jangan lupa bawa surat rujukan dari dokter gigi, kemudian daftar dan bayar ronsen yang kamu pilih. Selanjutnya kita akan ke ruangan radiologi. Berikut adalah ruangan untuk ronsen, panoramik, dan cephalometry.
First, you will need to remove any metal from the neck up, such as jewelry, necklaces, earrings, piercings, and also remove your glasses. Next, the dental provider may place a lead apron on you and have you walk into the panoramic machine. Oftentimes, they will have you hold the sides of it with your hands and will also let you know where you should put your feet. The dental provider will fix the height of the machine according to your height so you can comfortably bite down on the little stick. They will explain to you where you want your teeth according to the type of stick that they have for you to bite on. And then the dental provider will adjust where the lights need to be positioned relative to your face. Usually there is a light that goes straight in the middle of your face. You can sometimes see yourself if there's a mirror in front of you. And also there's sometimes lights on the sides to line up with specific structures in your mouth. Again, they will walk you through this. You don't need to know anything or prepare anything beforehand. It's a step-by-step thing, and they will let you know what to do for each step. The only thing you have to do is what we said earlier, make sure you're not wearing any metal from your neck up. Every machine is a little different, so listen carefully to the instructions that your dental provider will give you. Before they press the button to take the image, they will let you know if they want your tongue on the roof of your mouth or not, and sometimes they will even ask you to swallow beforehand as well. Once you are all set up, they will walk out of the room, or at least a 6-foot distance away from you, and press the button. The machine will go around your head. It usually takes less than 20 seconds, but again, every machine may differ slightly. However, it won't usually be more than 30 seconds. When the x-ray is being taken, you will usually hear a beeping noise while it moves around your head. Once it stops, you're done. They will take off the lead apron and check to make sure that your image came out clear. If it looks good, then you can put your metal stuff back on, such as your glasses, and you are all set.
All jewelry and metallic objects such as eyeglasses, necklaces, earrings, and hair clips should be removed. And guide the patient to the ray scan. Have the patient step into the safe between the ear rods. Adjust the height of the ray scan so the bottom of the ear rods are at approximately the same height as the patient's ears. Slide the ear rods so that the cones are gently touching the outer ear canal. Adjust the nation positioner down and slide it towards the patient. When everything is ready, instruct the patient to close their eyes. Press ready on the remote control, touchscreen, or scanner program. Press and hold the exposure switch as instructed in the scanner program. Press and hold the exposure switch for the entire exposure time. Release the exposure switch. After the image acquisition, make any desired optimal image by adjusting the sharpen or gamma value.
Berikut adalah ruangan untuk rongsen periapikal.
We are taking PAs, which are also known as periapicals. These allow us to see the entire root and area all around it, like to check for an abscess and the health of the tooth in general. So now that we're finishing up with the front teeth, the anterior teeth, we've now moved on to the back teeth, which are also known as the posterior teeth, where we take 2 in each quadrant, 1 for the molars and 1 for the premolars. You have 4 quadrants in your mouth: upper right, upper left, lower right, lower left. And that's what we're doing now. We already changed out the rings to properly fit for the back teeth. Different types of holders may be used. It doesn't have to be the XCP rings like you see here. It can also be a snap array, which looks like this. Either way, most of the images that will be taken in an FMX are PAs, the periapicals. At the end, we'll talk more about the bite wing x-rays. So right now we're doing the posterior PAs. And as you can see, it's pretty repetitive. We take the image, leave the room, press the button, wait for it to load on the screen, reposition it for the next section, and take the next one and repeat. So if you're someone who has any trouble with x-rays as the patient, if they are very uncomfortable for you or you have a severe gag reflex, I do have a video, which I will link in the bottom bar below, with tips and tricks to help make your x-ray experience more pleasant. So now let's watch the remaining images of the posterior PAs be taken. And after we finish the PAs, we will move on to the bite wings, which you will see at the end. Something to note, most FMX full mouth series x-rays are about 18 images. So like I said, you have the 6 anteriors, and then you have the 8 posteriors. And then in just a second, we'll finish up this last x-ray here, and then we'll set up and talk about the bite wing x-rays. Here we are, setting up for the bite wings. Right here, we're using the XCP, the rings again, but sometimes they will just use a tab without any of the rings. The bite wings are the ones that are usually taken routinely by themselves, but they can also be included in this full mouth series that we're taking today. The bite wings specifically help to screen for cavities and tartar between the back teeth, as well as help examine the level of the bone that holds your teeth in place.
Apakah rongsen itu berbahaya?
Tidak berbahaya jika dilakukan dengan benar dan sesuai kebutuhan medis. Resiko sangat kecil dibanding manfaatnya, terutama untuk diagnosis penyakit. Ibu hamil perlu lebih berhati-hati, tetapi bisa dilakukan dengan pengamanan ekstra.
Jadi jangan takut ya untuk rongsen gigi dan mulut.